Could you please tell us how the AMH test should be used in your opinion?
Okay, so like we said, AMH test, in order to use the AMH test, we need to understand the test itself. Yeah? So what test does is it measures AMH molecule in the blood. So AMH molecule is produced in females only by growing follicles which contains egg. So AMH in the blood tells us that some ovarian activity going on, ovaries recruiting follicles and preparing follicles for ovulation. So this is called antral follicles. If you see AMH, and that means that ovaries recruiting follicles. And also AMH or recruited follicles are a reflection of how much of egg reserve left in the ovaries, which means it can predict how long you will be producing follicles, which we call this ovarian fertility. So which means by just simply doing AMH, first you can tell how much of ovarian activity going on, which means how many follicles are getting recruited today. So, and which means that whether you have a lot of follicles on your ovaries, so high antral follicles, medium level of antral follicles on your ovaries, or low level of antral follicles. If AMH is low, that means very little follicle recruitment is going on. And also you can predict future fertility. That's why you can use for fertility screening. So AMH should be used for all women who are planning to have a child in the future, or trying to conceive now, or doing fertility treatment. So, but the purpose and interpretation is very different. If someone wants to have a child in the future, they need to do AMH to establish their baseline egg reserve, and also to tell how long they will be producing eggs for. So it doesn't give exact year when you run out of egg reserve, but it gives you a very good idea how long you will stay fertile in terms of your egg reserve. If your AMH is very low, when let us say your age is 30, your AMH is 3, then that means you have a short period of time left before you either complete your family by having kids earlier, or you preserve your fertility by freezing eggs or embryos. That's for women who want to have a child in the future. So then also it's important for women who are planning to start trying to conceive. So they decided, okay, so now we with a partner, we will start trying to conceive. If they need the IMH for fertility management, because they need to know whether they are ovulating. If they have very high AMH and having period every 3-4 months, that indicates they're not ovulating. They have a PCOS, very likely. Then also if they have very low AMH, they should not try for a long period of time, because it may be like they have such a low egg reserve left, and they may run out of egg reserve soon, which means they can try for short period of time, maybe 3 months, 6 months, depending on the AMH levels and all the fertility parameters. If not successful, they should seek fertility treatment earlier. So, and then third group of women who have an infertility, they try to conceive for a year, they didn't have a success, then they also should do AMH to understand what's good fertility treatment for them. Whether they should do IVF, whether they should do ovulation induction or IUI. So IMH can give a suggestion in terms of what's the right treatment, provided it's interpreted by clinician who actually has a good experience on interpretation of AMH or egg reserve. So then for patients undergoing IVF, the role is very different. Again, so it establishes egg reserve, and it helps us to decide which protocol should be used, and which ovarian stimulation drugs should be used, and which dose of ovarian stimulation you need to use to have a good number of eggs without increasing risk of OHSS, or increasing risk of having poor ovarian response. So trying to get optimal number of eggs. So AMH should be used in all women interested in fertility, but application is very different, interpretation is very different. So if you go through all these 5 parts, we did the 10 parts of AMH live stream on TikTok and Instagram. So if you go through number 1, today is number 10, so you have a very full good understanding. And as an even patient or member of public, you can tell what's actually what application AMH has got for you, because everyone's fertility is unique. Like I said, there's like fingerprint. There aren't any two people who have an exact same fertility. So because everyone's egg reserve is different, egg quality is different, their overall impact of their overall health to their fertility is different, fertility purpose is different, fertility timing is different. So everyone's fertility is unique, and they need to understand their own fertility by doing AMH test, for example, and they should be able to interpret what AMH or antral follicle count or pelvic ultrasound scan, what role these investigations play in their understanding of their fertility, so that they can plan their own fertility. Fertility planning doesn't mean fertility treatment. It doesn't mean IVF. Fertility planning means just simply understanding your baseline fertility, how long egg reserve you have left, and what should be your strategies to achieve your goals. Your fertility goal may be having 3 children, or having having 1 child after 5 years, or having 5 children starting after 5 years from now. So everyone has different purposes. For that, you need to understand your body, and without understanding your egg reserve, you cannot understand your fertility. So you have very little on, because everyone's fertility is different, everyone's egg reserve is different. To understand your own egg reserve, you need to do AMH and antral follicle count, maybe twice, because like we said, there's some variation, 30% variation in the results.